Now, you may have noticed that our Cough DDx sketch didn't mention what to think about when your patient's coughing up blood. That's because we wanted to give hemoptysis its very own DDx sketch. Obviously, coughing up blood tends to raise a good deal of concern, whereas an uncomplicated cough has a mostly benign differential. The differential for hemoptysis is much more sinister, which is why we're going to Dracula's mansion. Now, Dracula's crib wouldn't be complete without some vampires milling about, would it? Whoa, someone needs to learn the vampire cough. Take it easy on the blood punch next time, guy. Anyways, that vampire coughing drops of blood is our sketchy symbol for hemoptysis, which is defined as the coughing up of blood or blood-streaked sputum. Welp, I guess we know where he got that blood from. Hemoptysis is considered massive if more than 500 milliliters of blood is coughed up in a day, or more than 100 milliliters per hour. Massive hemoptysis is a medical emergency, and we'll be talking about its management later on in this sketch. While massive hemoptysis should rightly freak you out, small amounts of hemoptysis are less concerning and can typically be managed in the outpatient setting. Why is hemoptysis so scary, aside from the fact that there's blood everywhere? Well, blood loss is actually not the frightening part. If patients are going to die from hemoptysis, it'll be from asphyxiation and respiratory failure, not blood loss. Hence why this poor victim is choking and grabbing at his neck. Let's slap a Band-Aid on it. You'll be fine. Drama queen. It only takes a relatively small amount of clotted blood to fully obstruct an airway, leading to compromised gas exchange and asphyxiation. If you think way back to anatomy, remember that the lungs have a dual blood supply, the bronchial arteries and the pulmonary arteries. Hemoptysis can arise from either source, but the vast majority of massive hemoptysis originates from bronchial artery bleeding. That's why we've drawn in this artery-looking rain gutter running along a suspiciously bronchial-shaped chimney. Really? A chimney surrounding the front door? Looks like Dracula needs a visit from those fixer-upper guys, who, he may or may not eat. Although the bronchial arteries carry much less cardiac output than the pulmonary arteries, bronchial artery bleeding is a lot more worrisome. That's because blood in the bronchial arteries flows at systemic blood pressure, which is 5 to 10 times higher than pulmonary artery pressure, making bleeding much more massive when it does occur. To help you organize the differential for hemoptysis, let's categorize its causes by organ system: pulmonary, infectious, hematologic, vascular, autoimmune, and cardiac. To start, let's talk about the most common etiology of hemoptysis in developed countries: pulmonary diseases. See those shutters that look sort of lungy? Well, right below these pulmonary privacy shades is where we'll illustrate the pulmonary causes of hemoptysis. The most common cause of mild hemoptysis is acute or chronic bronchitis, hence the ruffles on Vlad here that resemble the bronchial tree. Bronchitis accounts for the majority of cases in developed countries. That's why Vlad is wearing our recurring sketchy #1 foam finger. Viral infections are the most common cause of acute bronchitis, so, as you might have guessed, patients typically have viral URI symptoms. Geez, Vlad. In the cape? That's just uncouth. These patients will also typically have a normal chest x-ray, by the way. We'll get into some pretty classic x-ray findings in a little bit, but with bronchitis, that radiograph should look as right as a rain of blood at a vampire rave. Alright, what if this cough has been going on for a while, and your patient has a significant smoking history? Well, don't count your Draculas before they've been stabbed and jump straight to cancer. Chronic bronchitis, a form of COPD, represented by this big blue bloated guest, is the most common cause of hemoptysis in heavy smokers. Look for the cardinal symptoms of cough: dyspnea, represented by our recurring sketchy symbol, the puff of air he's blowing out, and sputum production, represented by that green mucousy drink he's spilling. For more details on the characteristic presentation of COPD, check out our COPD and COPD exacerbation sketches. Speaking of cancer, bronchogenic carcinoma is another common cause of hemoptysis. At Sketchy, lung cancer is represented by our recurring symbol, the cancer crap, worn right across the chest of this old vampire. This vampire is old. Okay, I already said that. It's kind of rubbing it in. And holding a cigarette because patients with persistent hemoptysis and risk factors such as age over 50 and a heavy smoking history are at high risk for lung cancer. In these patients, you should always get a chest x-ray to evaluate for malignancy. Look for a nodule that's new, getting bigger, or is greater than 8 millimeters in size. Characteristic paraneoplastic symptoms may arise as well, such as hypercalcemia with squamous cell carcinoma or SIADH with small cell carcinoma. Head on over to the lung cancer sketch for all the bloody deets. Bronchiectasis is another common cause of hemoptysis in developed countries. In bronchiectasis, the airway becomes abnormally dilated from persistent inflammation, kind of like the dilated pomegranates on this pomegranate tree. In addition to cough, look for copious purulent sputum production, hence the purulent leakage from this gigantic rotten pomegranate. We are talking cupfuls of sputum every day. In patients with bronchiectasis, look for an elevated white blood cell count, represented by these white birds elevated above the pomegranate tree, as well as classic findings on imaging. Chest X-ray features that suggest bronchiectasis include dilated and thickened airways that show up as parallel lines, aka tram tracking, with irregular peripheral opacities that represent mucopurulent plugs. A chest CT will also show dilated and thickened airways filled with secretions, totally reminiscent of a cross-section of a pomegranate with its clusters of dilated, secretion-filled seeds. Yummy. For more info on bronchiectasis, check out our sketch dedicated to it later on in this unit. Now that we've covered the pulmonary causes of hemoptysis, let's move on to infectious causes, starting with the most common cause of hemoptysis in developing countries, tuberculosis. The classic symptoms of reactivation TB include fever, represented by a recurring sketchy symbol, the flame bandana, cough, and in advanced disease, night sweats, weight loss, hence how thin this guy is, and hemoptysis. Late in the disease course, you'll probably see leukocytosis, although labs are frequently normal in patients with TB. Patients from endemic regions who present with hemoptysis have TB until proven otherwise. They should be placed immediately on airborne respiratory isolation, represented by the N95 respirator this thin victim is wearing. On chest X-ray, reactivation TB will likely show apical infiltrates with cavitary lesions. Hilar lymphadenopathy is also common. Beyond TB, pneumonia can also cause hemoptysis. At sketchy, pneumonia is represented by our recurring symbol, the rusty chest plate on this empty suit of armor. The pneumonia pathogen most commonly associated with hemoptysis is Klebsiella pneumoniae, represented by our recurring sketchy micro symbol, the red spiked club. Classically, patients will complain about coughing up that delectable currant jelly sputum, which is why this hollow knight is holding up a big jar of red currant jelly. Hemoptysis in Klebsiella pneumonia occurs secondary to inflammation and necrosis of the pulmonary parenchyma. Patients with pneumonia commonly present with fever, dyspnea, and pleuritic chest pain, hence our recurring symbols adorning this empty suit of armor. The flame helmet, shark tooth necklace, and puff of air coming from the face mask. Wait, a puff of air? Is someone inside that empty suit of armor? Doesn't make it empty. Feel like I've been lied to. Expect to see leukocytosis as well, and on chest X-ray, look for lobar consolidation, kind of like what you see on this stained glass window, interstitial infiltrates, or both. For more details on the clinical presentation of pneumonia, check out our sketches dedicated to it in the infectious disease unit. One complication of pneumonia that can cause hemoptysis is lung abscess, represented by this lung-shaped tree full of big red apples. Lung abscesses present very similarly to regular old pneumonia, so look for fever, cough, pleuritic chest pain, and leukocytosis. On chest X-ray, look for a classic cavitary mass with an air fluid level. Alright, it's time to talk about fungus balls, aka aspergillosis. At sketchy, we represent chronic pulmonary aspergillosis with hay-filled lungs, full of hyphae, if you will. Chronic pulmonary aspergillosis most commonly presents in its chronic cavitary form, while less common manifestations include aspergillus nodules or a single aspergilloma, aka the infamous fungus ball. The most characteristic feature of chronic pulmonary aspergillosis on chest CT is a dense white fungus ball surrounded by a hypodense air crescent. Single or multiple nodules can also be seen. The chronic cavitary form of disease shows up as, you guessed it, multiple hypodense cavities. So, on our recurring sketchy black CT cat, we've drawn in a fungus ball for one eye and a hypodense cavity for the other. Just imagine that guy nibbling at your legs. creepy. Patients with chronic pulmonary aspergillosis classically present with constitutional symptoms of fever, weight loss, and fatigue, in addition to cough and hemoptysis. That said, remember that a single aspergilloma fungus ball can actually present with minimal systemic symptoms. In addition to those presenting symptoms, look for leukocytosis on labs. This next Aspergillus scarecrow looks like it's been through some stuff. Patched up heart, flank patches. Looks like they've put some city miles on that guy. Anywho, this sickly, patched up scarecrow is our sketchy symbol for invasive aspergillosis, a condition that affects immunocompromised patients. Hence our recurring sketchy crutches holding the scarecrow up. He definitely needs the help. In immunocompromised patients, such as recent bone marrow transplant patients and those with severe neutropenia, aspergillosis presents much more acutely and can spread beyond the lungs. In invasive aspergillosis, a chest CT will show multiple nodules with surrounding ground glass opacities, represented by the multiple fuzzy ground glass-looking white spots on this black CT cat. Pulmonary and infectious diseases make up the majority of cases of hemoptysis, but that said, there are a few less common but just as important causes to keep on your differential. Coagulopathy and severe thrombocytopenia can result in spontaneous bleeding from multiple sources, including the lungs. In addition, patients with hematologic causes of hemoptysis will also have bleeding in other locations, such as bruising, petechiae, nosebleeds, and GI bleeding. Hence the black eye and nosebleed on this uncontrollably bleeding victim. If you're suspecting a bleeding disorder, check for abnormal coagulation studies, such as PT-INR, represented by the PT parachute this vampire bat's wearing, PTT, represented by the PTT sound its flapping wings are making, and platelet count, represented by those broken plates on the ground. The next set of important causes of hemoptysis originate from the pulmonary vasculature. The most important cause to remember here is pulmonary embolism, represented by our recurring sketchy symbol, the bird's nest in this lung-shaped tree. Smaller emboli that get lodged in the periphery of the lung are more likely to cause infarction of the distal lung, which can hemorrhage, causing hemoptysis. Patients with PE will classically present with dyspnea and pleuritic chest pain. Hence our recurring puff of air and shark tooth necklace symbols on this human trying to make an early exit up the lung tree. Should have read the invite more closely, Braden. These patients will most likely have risk factors for venous thromboembolism formation, such as OCP use, represented by that OCP pill pack-shaped wheel, prolonged immobilization, like that vampire stuck in his wheelchair, or recent surgery, represented by the dirty scalpel he's holding. If you see symptoms and signs of a lower extremity DVT, such as swelling, pain, warmth, and erythema of the leg, in a patient with hemoptysis, PE should be high up on your differential. The test of choice for patients with a high probability of PE is CT pulmonary angiography, which will reveal a filling defect in the affected part of the lung. If pulmonary infarction has occurred, look for a hyperdense wedge of lung distal to the occlusion, just like that wedge of dead leaves distal to the nest. Wait, shouldn't we get a D-dimer or VQ something? If you're confused, fear not. We've got an entire sketch dedicated to PE, so make sure to check it out. In addition to PE, arteriovenous malformations in the lungs, unsurprisingly, can also predispose to bleeding and hemoptysis. At Sketchy, AVMs are represented by those blue to red branches of the pulmonary tree. Pulmonary AVMs are frequently associated with hereditary hemorrhagic telangiectasia, aka Osler-Weber-Rondeau syndrome. Look for cutaneous telangiectasias in these patients, like the red spots on the arm of this unfortunate human, to clue you in. While we're on the subject of vascular disease, let's not forget about the autoimmune diseases that can cause inflammation of blood vessels, aka vasculitis. Small vessel vasculitides, especially Goodpasture syndrome, granulomatosis with polyangiitis, aka Wegener's granulomatosis, and microscopic polyangiitis can all present with hemoptysis. That's why we've drawn in these small red vascular-looking candles, all aflame to represent vasculitis. Small vessel vasculitides affect the glomeruli as well. So make sure to order a urinalysis, represented by this bowl of lemonade. Sure, that's what that is. As well as a serum creatinine level, represented by our recurring sketchy symbol, the creatinine credit card, to evaluate renal function. For more details on these diseases, check out our small vessel vasculitis sketch. Finally, not to be outdone, even heart problems can cause hemoptysis. If that sounds counterintuitive, follow along with me here. Elevated pressures on the left side of the heart can transmit backwards through the pulmonary veins, causing increased pulmonary capillary pressures. If these pressures get high enough, the pulmonary capillaries can burst, a phenomenon called pulmonary apoplexy, and bam, hemoptysis. Severe mitral stenosis, represented by our recurring sketchy symbol, the narrow mitral miter hat, and decompensated heart failure, represented by that classic floppy heart balloon, are the two biggest cardiac causes of increased pulmonary capillary pressure and, accordingly, hemoptysis. In patients with mitral stenosis, listen for that characteristic low-pitched, rumbling mid-diastolic murmur, whereas patients with hemoptysis due to significant left ventricular failure will have an elevated BNP on labs, represented by our recurring sketchy BNP blimp flying high. On chest X-ray, patients with heart failure will likely have fluffy bibasilar opacities characteristic of pulmonary edema. For more info on mitral stenosis and heart failure, check out our dedicated sketches on them in the cardiology unit. Even with all these causes on the differential, it might blow your mind to hear that no cause is found in up to 30% of cases of hemoptysis. Idiopathic stuff. Always gotta ruin our fun. Anywho, that concludes our whirlwind tour through the causes of hemoptysis. Before we go, though, let's swing back and discuss the initial management of a condition we introduced earlier, massive hemoptysis. Let this unfortunate dude remind you that asphyxiation is the biggest threat to life in patients with massive hemoptysis, not exsanguination. Therefore, it's imperative to focus on stabilizing the patient's airway, oxygenation, and ventilation, the A and B of the ABCs, before you work on diagnosing the underlying cause. One quick and easy thing you can do is position the patient bleeding lung side down, enlisting gravity to keep blood from getting to the good lung and airway. For example, if your patient has a left-sided lung mass which you suspect is causing hemoptysis, place them in the left lateral decubitus position. See? Look at this guy here relaxing in the blood fountain, having the time of his life. Speaking of airway protection, you should have a low threshold for intubation in patients with massive hemoptysis. At Sketchy, intubation is represented by our recurring symbol, the snorkel tube. Intubation isolates the bleeding lung and protects the unaffected side, allowing patients, like this vampire, to breathe through all that blood. Woohoo! Party time! Guess this is a BYOB kind of party. Preferably type O. Get it? For patients with intractable massive hemoptysis, flexible bronchoscopy, represented by this vampire hunter using his scope-like flashlight, is the initial procedure of choice. Flex bronchs can localize the bleeding site, suction out the blood, and perform therapeutic interventions like electrocautery, or holy water, garlic, standard stuff. Finally, urgent thoracotomy and surgical intervention, represented by the vampire hunter's trusty scalpel blade, may be necessary if all other interventions are unable to control the patient's hemoptysis. All right, let's finish up this sketch with a review of the workup of patients presenting with hemoptysis. First things first, before you start an extensive workup, make sure that the blood is actually coming from the lungs. Since it all ends up coming out of the mouth, use your investigative skills to rule out bleeding from the mouth, nose, and GI tract that can mimic hemoptysis. Faking an ID to get into a vampire party is the easy part. Actually faking it while you're there? Different story. Yeah, I'm looking at you, Toothy. At least put on some makeup or something. After you've used your history and physical exam to narrow the list of possible diagnoses, it's time to order some labs. First, order a hemoglobin and hematocrit, represented by our recurring sketchy symbol, the H-shaped abacus, to quantify the severity of the bleeding. Further lab testing should be guided by those historical and physical exam clues you found earlier. Common labs that are useful in the majority of patients with hemoptysis include PT-INR, APTT, and platelet count to rule out a hematologic cause of hemoptysis. In addition, if you think an infection is to blame for your patient's hemoptysis, order a white blood cell count and differential. Leukocytosis is supportive of an infectious cause, such as pneumonia, TB, or aspergillosis. Once you're clued in, more specific tests will help you identify the specific microbe. Check out our sketches dedicated to these infectious diseases for more details on further workup. Renal function studies, such as UA and creatinine, are helpful if you suspect a small vessel vasculitis such as Goodpasture syndrome. While those labs are cooking, send the patient off to radiology. All patients with hemoptysis need a chest x-ray. It's the most important initial study for hemoptysis since it can clue you into the location and cause of bleeding. In patients with minimal hemoptysis, a normal chest x-ray, and a clear-cut etiology like acute bronchitis, no further testing is necessary. All abnormal chest x-rays should be followed by a chest CT, which can provide more details as to the etiology of hemoptysis. That said, a normal chest x-ray alone isn't sensitive enough to rule out a serious cause of hemoptysis. That's why patients with active or recurrent hemoptysis require a chest CT for further evaluation, even if the chest x-ray is normal. If your patient presents with massive hemoptysis, flexible bronchoscopy is the diagnostic procedure of choice because it can both locate the site of bleeding and perform interventions such as electrocautery to control the bleeding. Although I've heard flashing a crucifix at it works just as well. Well, that juicy dude floating in the fountain isn't going to suck himself. I mean, I'll see you guys on the... Sorry, I got a bit of garlic or something got in the... This is uncomfortable.